Let's talk about Tricopat, which has two main parts. One part is the skin puffing, and the other part is the iontophoresis. So why is Tricopat used? It can be utilized to block hair loss in conditions where there is an increased shedding, to speed the hair regrowth in the same time, to speed and potentiate the effect of drugs administered for alopecia, and so to allow drug penetration. So it can be utilized in telogen fluvium, so in the condition with increased shedding, in androgenetic alopecia to enhance drug penetration, and in other types of alopecia where drug absorption can be potentiated. So the use can be alone or with drugs or growth factor. So let's first see the indication that we started to investigate with Tricopat, which is telogen fluvium. The definition is of increased shedding, especially occurring in adult females that are really distressed by the increased shedding, which can be associated with a painful sensation of the scalp, which is called trichology. From a medical point of view, we can distinguish an acute and a chronic telogen fluvium. An acute telogen fluvium appears quickly, usually 2 to 3 months after an event that can be traced in the history of the patient, while in chronic telogen fluvium, the hair shedding is more stable. It lasts for at least 6 months or more, and trichodynia is very, very common. In both varieties, there is a great anxiety that the patient carries on, and what does the doctor may do? First of all, recognizing possible causes. Here you see the list of the possible causes that most frequently induce acute telogen fluvium. That is just a blockage of the hair cycle. So the anagen hair stops proliferating and go to telogen. So hair shedding occurs after 2 to 3 months from the condition that induces the hair shedding. And here you see the patient that has a normal mass of hair, but the pull test, which is a gentle traction of tuft of hair from the scalp, is positive. And if you do trichoscopy, you see this upright regrowing hair diffusely on the scalp. That means that after the hair is lost, a new hair is growing after. In chronic telogen fluvium, the condition is worse as the hair shedding lasts for several months. The patient does not feel followed by the doctor, so they carry these boxes full of hair in order to prove you that they had a hair shedding, but often there is no cause before the shedding. And if you look at this patient, they have a full mass of hair, but often they have thinning in the temporal area of the scalp. You see how the crown area is normal, no miniaturization, so no signs of androgenetic alopecia. So how do we approach telogen fluvium? First of all, we look for causes of this hair shedding, and as I told you, sometimes you don't find them. But you can use restoration of the hair cycle, do with food supplementation for at least 3 months, cosmetic lotion, and the first treatment that is effective in our experience is growth factor vehicled by iontophoresis. So Tricopat with growth factors is fast and strong. So the best treatment ever. And we proved this during this study where we perform growth factor with Tricopat in patients with telogen fluvium. And here you see the result in this table where we use the trichoscopy for measuring the anagen to telogen ratio. So after 4 cycles of Tricopat, we have increased anagen, so increased hair growth and decreased hair loss. And here you see this patient. This patient had an acute telogen fluvium after COVID infection. You remember that during pre-COVID epidemic, there was really an epidemic of increased shedding, and it was the first time in which Tricopat really was shown all over the world to be very effective to stop this really severe shedding. Look how much the hair density was decreased in the temporal area and how it was restored just after 4 months of treatment. And androgenetic alopecia. Androgenetic alopecia is the most common condition both in males and in females, characterized by hair thinning in the selected area of the scalp, which are the androgen-sensitive areas. Here you see how in males the prevalence can be over 70% with age. And what happens? There is a genetic predisposition, there is an increased sensitivity of androgens of selected area of the scalp, and the follicles undergo a progressive miniaturization. There is also an altered cycling with loss of the number of hair. Here you see the female presentation. Usually you have a diffuse thinning in the crown area with preservation of the hairline. And here you see the typical appearance of the scalp with bitemporal recession, vertex thinning, and anterior thinning in these 3 commonly seen patterns. Treatment of androgenetic alopecia follows guidelines that have been written a few years ago. They date back to 2018, but we have guidelines both for males and for females. So what is the role of Tricopat in these cases? There are several reasons for which you can suggest Tricopat to your patient with androgenetic alopecia. First of all, to delay time for starting a chronic treatment. All drugs for androgenetic alopecia are chronic, and if you have an 18-year-old male, you have to tell him that he will start the drug for the rest of his life. So if you use Tricopat, you can have 2 or 3 years before starting the drug intake, as you can slow down the progression of androgenetic alopecia. You can also have Tricopat when patients start the drug to show results earlier than before, because Tricopat speeds the onset of improvement with drug in androgenetic alopecia. Or in patients who, after 1 year, are not completely satisfied. Here you see a patient in medical therapy, he wants to gain some more results. And before starting a combination therapy, you can use Tricopat for 4 times and have improvement without having a second drug for the rest of his life. Or in patients in treatment who are losing effectiveness. All drugs that we utilize for androgenetic alopecia give the best result after one year and a half year of therapy. And then after 4 to 5 years, they gradually lose a bit of effectiveness. If you want to push the effectiveness again, you can use Tricopat for sessions, and the patient goes back to the best improvement. So as you see, you can position the use of Tricopat in androgenetic alopecia in several ways. And you can use it just with growth factor or with a drug. And we have 2 studies about it. Here you have the same study that we did for telogen effluvium with growth factor. We also explore patients with androgenetic alopecia, both males and females. And here you see the result. We have an improved thickness of the hair in this patient just with the growth factor in androgenetic alopecia. Here you see the example, and here you see the gradual thickening of the hair, where the mass of growth factor that you have in the scalp really potentiate hair growth. But also we tried Tricopat with dutasteride, so enhancing drug penetration together with skin packing really improves androgenetic alopecia. And this was done both in postmenopausal females and in males. And here you see both the good result in males and in females. The all patients were really happy about the result. But of course, whenever you have a diffuse type of alopecia, you can use Tricopat. And this is another example that we published with corticosteroid. So you can enhance penetration of topical corticosteroid in another kind of diffuse alopecia, which is called alopecia areata incognita, which is a variety of the autoimmune alopecia areata without patches. It's typical of young females, and it is characterized by increased shedding and diffuse alopecia. So you make the diagnosis, and instead of having the patient applying topical drugs on the scalp every night for months, you can do cycles of Tricopat plus topical corticosteroid, having the same result with less bothering of the patient. So here you see another indication, and more indications are coming with our experience, because when you know how the machine is utilized, you can use it in several other conditions. So it is a great advance in alopecia management, and we are very proud to show here our result. And Michaela, we show you a comparison between the different techniques and our experience, particularly with Tricopat. I thank you very much for your attention.
Different part of the world, and we have a very great experience, you know, with this technique, and we share always in these different positions and places all the knowledge that we collect in this year. I started to use Tricopat many years ago. It's last 10 years like this. Today we have to celebrate 10 years of the instrument. So for this reason, we are Bianca and I a pioneer of this technique, and we believed in the past of the use of this technique because we started a few years before with the other physical therapy. But in hair regrowth, in hair disease today, it's very important. There are a lot of patients that ask us to start any physical therapy. It depends on the type and the possibility of the doctor to select which therapy is just for these patients. But in the year, I started with a lot of them as PRP, microneedling, and so on. And at the end, we arrived 10 years ago in this technique. And in the difference of the previous technique, this methodology today has a lot of publication, and Bianca showed before a lot of them, that confirm the role of this technique in different diseases. So I think it is the most important also concept to collect, because you can use not only one disease as the other technique, because this technique is the only technique that is a combination of different methodology. And this is the big difference, and this is a very variability of this instrument. And in the last 10 years, there are a lot of patients that require the use of physical therapy, because there is a necessity to improve some result, because the medical therapy maybe it's possible not induce enough result, or maybe because they are not ready to start a medical therapy for all their life. And in these years, there is a lot of approaches, phoresis, non-phoresis, microneedling, lasers, that the goal of this therapy is to induce a good result, faster result, only in a topical way, without side effect and without any interaction with the drug. And so for this reason, there are a lot of these patients that require, that asked to use this type of therapy. And the list is very long, before the other table that we collected in the first years, because in the year we start with PRP, is one of the first technique, lasers, microneedling, and arrive is the last but not the least, because it's the only one that arrived with a very great publication about different diseases. And Tricopat is today, in general, with all the other physical therapy, recommended especially to use a faster improvement, so the person that required to improve faster than to wait normally 6 months or 1 year to look at the result of a medical therapy, to delay the medical therapy. And this is especially important in young patients. I started to use Tricopat also in patients with 12 years old, because unfortunately progenetic alopecia is today very early possibility, early appearance, so it is not easy to manage a drug in this type of patients. And we use not a drug, only a methodology without any pain, because don't forget, all the other medical therapy induce pain during the application, during the modality. And to stop errors, again, the first choice in telogen effluvium is especially cosmetic therapy, but it requires time, it requires months. It's the only device that with the first or maybe second application, second session, it induces a very important reducing or stopping of the hair shedding. But why Tricopat today is so important, why Tricopat is so good in hair disease? Because there is a combination. You know well and I surely that there are 5 types of action in the same machine, in the same instrument. So we have the typical mechanical trauma with the microdermal incision with the pressure wave. On the other side, we have the electrophoresis of the absorption, the transdermal absorption, and then we have the anti-inflammatory effect and the activation of the microcirculation, the electrostimulation, and the photostimulation. All these methods are already approved in the different methodology, but alone. In this way, we can combine everything together. All of these, in fact, are already confirmed with this role in the different diseases. So we have the dermal incision, so the mechanical way, the injuries that we necessity to repair as a microneedling, as a POP, and for this reason we recovered the fibroblast to reduce this reparation and is induced the activation of the growth factor, the internal growth factor. Then we apply the external growth factor. This is an hamburger. This is the name that I call it this technique. This is an hamburger file. And in addition, the pressure wave induces this action peripherically at the all around the hair follicle, all diffusely on the scalp. Then we have the transdermal delivery. The electrophoresis is the only way to arrive directly with the molecules, any type of molecular today we can say, directly in the dermal papilla. We arrive directly in the site where there is inflammation, the infection, and so on. And then we have the electrostimulation. In the electrostimulation, we have 2 important actions. First of all, the blood microcirculation, because we have a direct action on the muscle of the capillaries that are very high level of the scalp. And you know, when you want to treat any telogen effluvium, any hair shedding, the microcirculation, the massage of the cosmetic is the only way to arrive in the site. On the other side, we have an action on the nerve, the sensitive nerve. And many cases today, our telogen effluvium is together with a very painful sensation that is named trichodynia, that is not easy to manage. It's very difficult. Some patients never can sleep because it's impossible to put the occipital side on the pillow, so it's very difficult to manage it for them. It's the only device that arrives directly on the fiber seam that conduct the painful sensation of the scalp, and they arrive then to moderate, to regulate this stimulation to improve the trichodynia in the first session. Finally, we have the photostimulation, laser low density. All the other technique is approved in 2006, 20 years ago, for androgenetic alopecia, for different hair diseases. And there is a combination of therapy. So, first of all, the Tricopat, we have the dermal incision, and we have the mechanical pressure, and the electrophoresis, a combination again of different techniques. Don't forget to explain that it's important to apply the gel before the first session, the first part. Then we have to look at it with skin tablet. Then we have to reapply another gel, and then we move with the second part with the electrophoresis. In the electrophoresis, we have also the vascular activation together with also the electrostimulation. So we have to combine. First part, mechanical, that arrive on the, especially on the reparation of this injury that not induce any bleeding, any pain. So the problem with the patient is no problem, any side effect, any precaution, any contraindication. So it's very easy. I use it also even during pregnancy. This is not a problem for the baby, for anyone. So it's a very safe modality to use a lot of improvement on your patient. Then we have the iontophoresis, where there is one side, the blood, that is the most important if you want again to repair, to use a new hair cycle. Is the only way to retake the growth factor that are directly on the cycle that you use an elongation of the anagen tail. It's the most important to induce another telogen fluid, so another shedding. This is a very important. Why transdermal delivery today is very important? Transdermal delivery is a very safe modality. It's iontophoresis is used before us physiotherapists to induce the absorption of anti-inflammatory drug, corticosteroid drug directly on the joint. So think about it is possible to go down in the vein part, and this is confirmed. You can use a locally effect only without any problem in the systemic, without any also side effect, any sensation reported by the patient. And it is confirmed because in this last paper, they confirm diverse methodology to have transdermal absorption. And you can see that the iontophoresis is the first one, because it's the most safe, the most faster, without with a very less side effect. It's the most safe, as you can see, but especially with a very light skin reaction. And this is especially reported on the face, because it's different in your face with your scalp. Think about the scalp. The skin is thicker and it is not visible, so there are any problem with the patient. Any erythema, any irritation, never reported in my experience of 10 years with this machine. Today, the state of art of the iontophoresis is very review, because it's a great technique. It is again replaced with our patient, and we use this electronic current that drives directly the molecule in the dermal papilla. In the dermal papilla, there is the inflammation. There is the really alteration of the cycle that is shorter. For this reason, our hair is less, and there is an enhancer of the hair shedding. Today, iontophoresis is a physical therapy. It's possible to use in different applications, physiotherapists, orthopedics, and so on. It's a very very safe, it's very easy to apply to product. It's very not so difficult to the application really. It's simple, it's not invasive, it's also the device, it's easy to remove, to stop it. If there is any problem, you have only to eliminate the device on the scalp. And also you can combine with other methodology. So it is not alone, you can use every week also combination with other methodology and other drug. The methodology, so the action of the iontophoresis is to use an electrostimulation, and that uses the absorption, the skin penetration, and it's important, like with this electrosmosis, to use always gel. This is very important. It's important to have a pH 3.5, 5.5, because it's the only way to apply directly infundibular, don't forget. But it is possible to confirm? Yes. There are a lot of studies. I think that many years ago, when it is some study that start to use iontophoresis, one of these is about minoxidil. So one of these is about scalp disease. And it is confirmed in vivo and in vitro that the absorption of minoxidil is 6 times more, 6 times higher than the use of locally minoxidil. For this reason, in the years, we start to use this methodology in different diseases. As Bianca told before, today we confirm the role of with the publication with androgenetic alopecia, with telogen effluvium, and with alopecia areata incognita. But it is confirmed because it, again, is not alone. We have not only the microincision, not only the electrostimulation, but the ionophoresis, but we have the LED light. LED light, it is possible to use in two different modalities, in blue light, in red light. The different is especially the intensity, the nanometry, and it is a very safe methodology. It's used many years ago, 20 years ago, for hair disease, different hair disease. It's used for psoriasis because there is a very great anti-inflammatory effect, and it's a very non-invasive way. The red light, it starts to use 613, 618 nanometer with the activity on the fibroblaster. So for this reason, it's used also in rejuvenament because there is the activation of the fibroblasts that repair an injury. Think about the injury that you used before the first step and how we can repair directly in the second part. And for this reason, you can use this technique also in patients with inflammatory diseases, chronic dermatitis, and psoriasis, because there is not only a trigger effect, but also a reparation together a few minutes later. And the effect of red light is especially, you can see that is on the dermal in superficial, and it is important, especially for psoriasis, where there is this elongation of the dermal papilla. On the other side, we can use blue light. Blue light is especially in 420 to 440 nanometer, and is today, for us, is used for acne because it is a very great action on antibacterial. And we start to use also on the scalp in different scalp disease as eruption, acne from eruption, and I have some patients also with rosacea of the scalp. It's a very great result because not always it's possible to treat scalp rosacea with a cream and so on. It's not easy. The blue light is a very great action on bacterial acne, and it is not only an antibacterial, but together with all the other machines, an anti-inflammatory. And think about how the use of antibiotics as the first therapy in acne is for the anti-inflammatory effect, not for antibacterial effect. So because it's not the infection and acne disease. There are some studies also in androgenetic alopecia. Before of us, you know, there is some study that confirm the role of androgenetic alopecia of the LED therapy alone again to use a nerve density increase in 90% of the cases. And this improvement is also, look at it also with the clinical picture in different degrees. You can use a very good result alone, almost only LED therapy. Think about all together with the other type of the device. In general, it's a tissue reparation, and there are possibly on the face to have some disease, some side effects, you can say. But the most important is the improvement of inflammatory disease as psoriasis, atopic dermatitis. Radiation therapy is a very safe modality. So today it's a very safe, non-invasive, cost-effective, and suitable for also home use. There are some devices that you can use at home. There are not protocols that create only the use of LED therapy near on the skin, so there is not a standardized method, but it's also until now the same problem of PRP. The electrostimulation is the other part of the device where there is the use today of this stimulation in chronic wound, tissue regeneration, modulation, inflammation, and the stimulation of skin cells. Again, is a modality to repair the injury that we induce with the skin packing together. So for this reason, it's a very combined therapy, it's a very combination of different modalities. It's a very safe, it's not pharmacological, and today we can use it with a different disease. One of these is on the scalp. This capacity of the electrostimulation to use this reparation is because there is the stimulation of the blood circulation, because it arrives directly on the muscle or the vascular that are all over the capillaries in our body, but especially in this case on the scalp. And this stimulation recall again all the growth factors, and the growth factors are the most important to use in elongation of our cycle. and together again with the tissue reparation. So the mechanism of action, you can see it's not one, it's a lot of them. That for this reason, it arrives in the different part of what happens in a hair's anagen cycle, when it is reduced, when it is too fast. So it is the miniaturization and hair shedding. And it is a very great reparation, and especially the enhance of the fibrosis that are possible to have in scarring alopecia. For this reason, we decided to start to treat this methodology also in some type of scarring alopecia. And the conclusion also of this study in vitro confirmed that there is an accelerate of the healing of the intake of the epidermal to normal. When you decide to use Tricopat in different diseases, there are some different methods. You can use androgenetic alopecia, Tilogene fluvium every month with the application of the growth factor, especially mild form. In case of moderate androgenetic alopecia, it's well used dutasteride. In case of diffuse alopecia, we are incontinent, but today we start to use all the scarring alopecia as we brief. You have to use steroid, so triamcinolone acetonide in gel, and it's better to use it every 3 weeks. And as Bianca told before, because why we use today in androgenetic alopecia? Because on one side there are some patients that lost some results during the time, because it's not possible to use medical therapy for the age, for example, because they would like to have more results, even if medical therapy is good, or maybe they would like to have faster results. But today, especially with the other expert of transplant, we use and I start to use in many patients that are prepared to have a hair transplant. Because the most important goal of Tricopat in androgenetic alopecia, for the goal which is the mechanism of androgenetic alopecia, that is not only miniaturization, but also the theory of empty follicles, so the reduce of the number that the hair that emerge from the same follicular unit. The goal of Tricopat in androgenetic is to stimulate new hair from the same follicular unit. So if you have more hair, you can have a better transplant, don't forget it. And today we use growth factor in initial form, dutasteride gel in late form. It's also to start alone, together with medical therapy after 1 year, if you want to have an improvement without the necessity to start maybe a new drug, a second drug again for the life of the patient, don't forget. And which is, what is it, sorry, present in the growth factor? All the most important growth factors that are normal, that we product every day to induce our cycle. So all these drugs, vascular endothelial, insulin, growth factor, beta, fibroblast, and so on, are all the growth factors that arrive directly from the cycle of the anagen, in the position of the anagen, elongate this phase. On the other side, it is also the microcirculation, because again, if you want to treat any disease, you have absolutely, with the drug or not, to use the enhancer of the microcirculation and again to elongate the anagen phase. Think about minoxidil. Minoxidil is a vasodilator, so the role is to enhance the microcirculation, and we can do this without the drug in these cases. And we confirm it with our publication. This is the second. The first is a pilot study that we put in the World Congress in Madrid in 2018 with only 20 patients, but we proved this is a 60 patient affected by androgenetic alopecia and Tilogene fluvium. And always per session, we compare the result in an objective way and also with a self-questionnaire of the patient. That all of them reported very compliance, high compliance, very pleasant modality of this application without any pain. And also, no one of our patients stopped the therapy before in all our studies. And these are some results. Don't forget, these are our first results. We try to put this patient without any other therapy. We decide to use this therapy in different degrees of alopecia. Completely recover because it might fall, we need also to apply the medical, but we had to understand which is really the action. So all these measures are without any other bias in our study, with the same methodology. And the same methodology that we applied before with our study of PRP and microneedling, and our comparison with the previous technique confirmed that Tricopat is with high compliance. The patients are are happier, but especially the results are